There are new guidelines for screening and treating elevated cholesterol for the prevention of cardiovascular disease, and I am so excited to talk to you all about it. My name is Golfran Rivera. I'm a board-certified physician associate, and I practice family medicine here in Fayetteville, North Carolina. Elevated cholesterol and preventing cardiovascular disease are topics that I talk about on a regular basis with my patients here at TrueCare DPC. And I'm actually very excited about the most recent guidelines that came out by the American Heart Association and the American College of Cardiology and so on. I'm also very perplexed in the way that clinicians on social media and online are framing these guidelines. As somebody who is big on informed decision-making and educating my patients, I wanted to make this video to clarify some things that you may be hearing and give you some more details about how these guidelines are likely to affect your care. The first big topic of discussion that we have to address is what is the deal with cholesterol? It has become very controversial on social media, much like everything else, so I want to address that with you guys. Why do we care so much about cholesterol? The thing is that cholesterol is something that over decades now, we have shown in medicine, in the field of medicine, as an independent risk factor for cardiovascular disease. But what does that really mean? Okay, when we look over the years at different populations and different types of trials, some observational trials, some interventional trials, what we find as a pattern that continues to come out is that when comparing patients who have elevated levels of cholesterol, specifically LDL cholesterol, and even more specifically other versions like LPA, we find that they are at increased risk of developing cardiovascular disease, and that can be in the way of heart attacks, strokes, or other arterial diseases. Now, an important piece to understand in what I just said is that first and foremost, we are looking at a comparison, right? So when we talk about an increased risk, we are comparing a group who has normal or low levels of cholesterol versus those who have higher levels of cholesterol. The other thing to understand is that just because this is the general pattern doesn't mean that it is the case for every single person. When we talk about public health and we're sharing public health information, we cannot get into the nitty-gritty details of each individual case. And this is why sometimes what you hear regarding the risks associated with cholesterol don't match your individual story or the stories of family members. It is true that by and large what we see is elevated cholesterol, elevated risk. But cholesterol by itself doesn't tell the whole picture. That's why I am so excited about these most recent guidelines, because more than ever, I think, they are pushing for individual risk assessment. Now, before I go too far, I do want to address that sometimes people will overcorrect and straight up downplay or act like cholesterol is irrelevant. Okay, sometimes some people are even telling you that getting it as high as you want it to be is better for your health. We want to avoid all kinds of extremes in general. And I think these guidelines really encourage this. How do they do that? First, they emphasize individual risk assessment. Now, this is huge because many times, especially in our current healthcare model, where we apply a lot of population-based data to individuals, having these guidelines formally encourage and exhort really clinicians to do an individual risk assessment, I think is huge. It is already my standard practice to do these types of risk assessments for my patients, but what these guidelines add to us is that most of our risk calculating tools up until now have been known to overestimate risk. And that's important because if we're overestimating risk, we could be overtreating, right? Or we could be overdiagnosing, okay? And so what these new guidelines give us is a tool that is shown to not overestimate risk as much as the other ones, which is huge. Another thing that I love is that these guidelines emphasize that lifestyle interventions, the way we sleep, the exercise that we're doing, our diets, right? Our overall lifestyle is key, not just like a part of, but the literal foundation for preventing cardiovascular disease. And the authors go on to encourage and exhort clinicians to make sure that as part of an individual risk assessment, we are taking the time to really understand what our patients are doing in their day-to-day life, in the way that they eat, in the way that they move, in the way that they sleep, and they manage their stress, to reduce their cardiovascular risk. And this is one of the most important and essential steps in reducing cardiovascular disease. Then, after taking an individualized risk assessment using these validated tools, we have a discussion about what role, if any, pharmacotherapy may play or the use of medications may play. This is where I'm perplexed because as I see clinicians online, they seem to be interpreting the guidelines as another opportunity to champion the use of medications for reducing cholesterol. More specifically, we're seeing a lot of clinicians, a lot of doctors and PAs and NPs talking about the importance of making sure you're taking a statin. And I find that interesting because yes, while the guidelines absolutely provide us the evidence for the safety and the efficacy of statins, the long-standing history of their use, their safe use in reducing cardiovascular disease, these guidelines, I think more than ever, really balance that information with our individual patient's risk profile and their preferences. Something that I think has gotten lost in medicine today, or it seems that way from where I'm standing. Evidence-based medicine involves using research, right? Randomized controlled trials, observational studies, and the like. Clinical expertise, right? So, if you're a cardiologist who really works with a lot of patients with cardiovascular disease, or if you're someone like me in primary care and you see patients on a regular, that matters too. But the third pillar, which is a pillar of evidence-based medicine, is patient values. And these guidelines really push into that. So the way I read it, it's not saying, if you hit a certain threshold, boom, you need a statin. No, it's you need to have a serious conversation. And how you have this conversation is using the information of what this patient's baseline risk is, what their personal values are, and then, of course, the safety and efficacy of these medications. And then once you step into that, assuming your patient has decided that this is appropriate treatment for them, have real goals that you're aiming for, not arbitrary goals of just as low as you go, with real endpoints that matter for our patients, right? And so I'm excited about these guidelines because the way I read them is they're emphasizing the fundamental, and really, of course, they align with the philosophy that we have here at True Care DPC. With informed decision making, our patients get individualized risk assessments, emphasizing what they can do at home day in and day out to reduce the risk of disease, reduce the risk of burdening them with more and more medications. And then if and when we need medications, knowing why they're useful, to what extent, like for how long are they actually going to benefit the patient, and having a real plan of how this aligns with their values and their goals for their care. I hope you found this useful. If you did, please make sure you like, you follow, and share your comments below. What's your take? If you've read the guidelines, I'd love to get some feedback from you. How does this compare to some of the other things you're hearing online? And if you happen to be in the Fayetteville area and you're looking for primary care clinicians who are happy to have these conversations with you, who will do the individualized risk assessment, feel free to check us out at truecaredpc.com. We're here in Fayetteville, North Carolina. God bless you guys. Thank you so much for taking the time to watch.